Jennifer. I'm a dietitian here at St. Joe's and Redwood Memorial Hospital. I've been here for 10 years this August. We're here today because we have been watching Providence slowly cut away our services in this area, cut back on wages, vacation, health insurance to our caregivers who are here to care for our patients in this community. Dietitians have always been a small group, but when I started here 10 years ago, between the two hospitals, there were 7 dietitians. Now there are 4 between the two hospitals. In addition, I've watched other staff, other departments get smaller, patients wait longer. For my department, if one of us goes on vacation or gets sick, the rest of us have to scramble because we have no backup, we have no help, and then not all of our patients get seen. But we should be able to take time off. We can't work every day. But not staffing us sufficiently is only hurting patient care and making us work longer and burn out quicker. We've learned that Providence will say that they want high turnover. They only want people here for a year or 2 before they move on because they don't want to offer competitive wages. They don't want to offer full staffing because they don't want to spend the money on the community. They want to save their money. They've opened, they've opened a venture capital fund with $150 million they've gotten in not-for-profit. So they are not caring about any of the communities that they are in. They are coming in and wiping out services and leaving us scrambling for health care.
Were there bad faith negotiations happening?
Since I'm fairly new to the bargaining committee, I have been able to listen in a couple of times and have heard disparaging marks against the union, as well as just being completely disrespectful to the members and to the union staff. But those are my few and very far between experiences. Unfortunately, I'm still pretty new at that, so I don't know a lot for that part. The acute rehab closure, that facility was opened in '87. It was ranked one of the top in the nation, as far as I understand, if not just in the state. It was a big part of our community. I don't think people realized how much we needed that facility in this community. Our patients have nowhere to go. They are now staying in the hospital longer, more turnover than we were already having. They have nowhere to go, and so many times now they are being sent out of the area and none of their family can afford to go see them. Those other facilities that are also putting on an informational picket today, they're being now more burdened because we're sending our patients to them and they cut services down there as well, so they can't take on more.
I asked Pat Kanzler this, so I'll ask you as well. From your perspective as a union member with NUHW, if you had an opportunity to speak directly or convey a message directly to the CEO or executive director of Providence here, what would that message be?
That's a good one. Give me a minute.
Yeah, for sure.
I suppose my message to Providence or to the CEO would be, Providence is a healthcare company. They are supposed to be committing to the communities that they are in and supporting those communities and helping them grow and helping those services flourish and take care of their community, their people, their caregivers, whether it be their employees or their patients. But all we see you doing is coming in and taking away and stripping us of our long-time established medical facilities when we are already in a huge deficit of medical care in this area and in all the areas that they're starting to strike.
When I say union, you say power. Union. Power. Union. Power. Union. Power.